Hey everyone, and welcome to This Explainer. Today, we're tackling something absolutely crucial, those everyday recovery questions that actually pop up once you finally get home from spine surgery. We're talking about the highly practical things that happen in the kitchen, the car, or the bedroom when you're just trying to navigate your day-to-day life. Because, let's face it, most discharge papers tell you the big rules, right? But they rarely cover those highly specific 9 p.m. worries. When you're just trying to figure out how to get ready for bed, or even just put your socks on, the big clinical guidelines don't always give you the immediate, practical answer you need. It is completely normal to feel a little frustrated when simple tasks suddenly require, well, a whole lot of planning. So today we're going to walk through a typical day in recovery. We'll cover the rules of recovery, movement and hygiene, sleep and dressing tips, returning to daily life, handling accidents and urgent symptoms, and wrap up with finding your new normal.
All right, Section 1, the rules of recovery. We're starting with the absolute golden rule that literally guides everything else we're going to talk about today. And here it is. Your surgical team's instructions always come first, period. Recovery timelines vary wildly depending on your specific procedure, your incision, your unique restrictions, and honestly just how you heal. Because your body's healing response is entirely individual, your team is the ultimate authority. Think of this explainer as a handy, practical companion to their formal guidance. Moving right along to Section 2, movement and hygiene. Let's look at how safe movement really builds the foundation of a good day, starting right from the moment you wake up.
Okay, so picture this. You're waking up and need to get out of bed. You're going to want to use the log roll. It's a simple, highly effective technique. Gently brace your core, roll your entire body as one solid unit onto your side, drop your legs over the edge of the bed, and push up with your top arm. The key takeaway here, you want to keep your shoulders and hips perfectly aligned to absolutely avoid any sharp bending or twisting at the waist.
Now, when it comes to getting clean, there's a massive, vital distinction between showering and soaking. Many patients are allowed to shower within the first few days, once cleared by their team, basically letting the water hit the shoulders and run down. But soaking, that means baths, pools, and hot tubs. Those absolutely must wait until you are specifically cleared. You really have to protect that incision from submerging and watch closely for any concerning changes. Okay, Section 3, sleep and dressing tips. Let's tackle the surprisingly tricky tasks of putting on clothes and actually getting comfortable.
Finding a comfortable sleep position that first week can be really tough. If you're a back sleeper, placing a small pillow right under your knees often relieves a lot of lower back pressure. For side sleeping, try a pillow between the knees to keep your spine aligned. Stomach sleeping? Yeah, that's generally discouraged early on. Always follow your procedure-specific guidance, for sure, but these simple pillow placements can honestly do wonders for your spine while you heal.
And then there's getting dressed. It sounds like a total breeze, until you're the one trying to put on socks. Seriously, grab some simple dressing tools. Reachers, sock aids, long-handled shoehorns, and slip-on shoes. They can make that first week infinitely easier. Just sit on the edge of the bed or a sturdy chair and let these tools completely eliminate the need to awkwardly bend forward at the waist.
Section 4, returning to daily life. We're talking about lifting, driving, and intimacy. The interactive parts of life you're probably super eager to get back to.
When it comes to lifting, you really can't just look at pound limits. Think about the difference between a dumbbell and, say, a puppy or a grandchild. A dumbbell is predictable, it's static, and it's easy to hold close to your body. A child or a pet, they wiggle, they jump, they shift their weight, and they require awkward reaching. That unpredictability is exactly why you must wait to lift them until you're explicitly cleared by your team, even if it's emotionally really tough to hold off.
Next up is driving, which is a highly sensitive activity, both legally and medically. You absolutely must meet 4 specific conditions before getting behind the wheel. You must be explicitly cleared by the surgical team, entirely off opioid or sedating medications, your pain needs to be comfortably controlled so it isn't a distraction, and your reaction time has to feel perfectly normal to safely turn and brake.
As for timelines, well, some patients with minimally invasive procedures might discuss driving around weeks 2 or 3. However, fusions or cervical surgeries are likely going to require more time. Your safe reaction times, your overall mobility, and your physical ability to just turn your head safely all dictate this timeline.
We also really need to talk about intimacy. Sexual activity is a totally normal part of life, and I want to emphasize that there are no embarrassing questions in spine recovery. Handle intimacy respectfully and calmly. Just ask your team for clear guidance.
Early on, simply avoid any positions that require bending, twisting, bracing, or putting any pressure whatsoever on the surgical area. All right, Section 5, Accidents and Urgent Symptoms. Let's navigate those scary what-ifs and the sudden moments of panic when our bodies do something unexpected. So many patients panic and wonder, I accidentally sneezed or coughed or twisted. Did I just ruin my surgery? Let's de-escalate that fear right now. Your body is generally much more resilient than your panic suggests. Accidental movements rarely undo a surgery. If you feel a sneeze coming on, just gently brace your core, keep your shoulders and hips aligned, and let it happen. You're going to be okay. However, you definitely need to call your surgical team if you experience a new pain pattern, new weakness, new numbness, or severe pain that feels clearly different from your usual baseline recovery pain. You also need to keep an eye out for a fever or concerning changes around your incision. If something feels distinctly wrong, your team absolutely wants you to call them. Now, it is absolutely crucial to identify true emergencies. If you notice bowel or bladder changes, saddle area numbness, which means numbness between the legs, or rapidly worsening weakness in your arms or legs, do not wait. Plus, if you experience chest pain, shortness of breath, or sudden calf swelling, go straight to the emergency department or call 911. Which brings us to our final section, Section 6, Finding Your New Normal with the Vertrae Approach. Vertrae, which is a comprehensive spine-only center led by Dr. Kamal Woods, helps patients understand exactly what realistic spine recovery looks like. The team there truly believes in robust support, ensuring patients across Southwest Ohio aren't left entirely guessing about how to navigate their daily lives after they head home. And this is their core philosophy. The goal is not to memorize every single medical rule. The goal is simply to know what questions to ask, how to move safely day to day, and when to pick up the phone for guidance. Give yourself some grace during this process. You don't need to be perfect. You just need to communicate honestly with your team. Remember this final thought as we wrap up. Recovery questions are completely normal, and the most useful answers, they will always come from your own surgical team. But there are no embarrassing questions in spine recovery, and the right guidance makes the first few weeks at home infinitely less confusing. Trust your body, trust your team, and take it one safe step at a time. So, I'll leave you with this. Look around your home right now. What is one small adjustment you can make today to give your spine the stress-free environment it needs to heal?